Thank you for joining my lecture on Chapter 16, the lymphatic and immune system. In this chapter, we're going to cover the lymphatic system, the immune system molecules, different immune system cells, hypersensitivity of the immune system, and our immune system defenses. In my search for some interesting facts about the immune system, I found that the immune system returns 3 liters of fluid each day from the tissues to the circulatory system. A study was performed and they determined that having friends, family, and significant others strengthens our immune system by 60%. So what is the lymphatic system? The lymphatic system is an important component of the cardiovascular system because it returns fluid back to the circulatory system. There are several important structures that make up the lymphatic system, such as the lymphatic vessels, lymphatic nodes, and lymphoid organs, such as the thymus and the spleen. The job of these organs is to filter the body fluids and remove harmful particles before they can damage the body, and this fluid is referred to as lymph. So we talked about in a previous lecture how hydrostatic pressure in the capillaries on the arterial side causes fluids to move out of the capillaries and into the interstitial spaces. A lot of this fluid is returned on, collected by the lymphatic ducts and filtered and returned back to the circulatory system via the venous system. I thought this was a good image to show us or give us an understanding of how these lymphatic capillaries are weaved in and around the arterial venous capillary beds. So you can see here the arterial on the left, and it's branching out into the capillaries, and we can see the arterial and the venous side, and interwoven in these beds are these lymphatic vessels. So as fluid moves out of the capillaries and into the surrounding tissues, like I said, a lot of it is picked up through these lymphatic capillaries and carried through the lymphatic system, filtered and eventually returned back into the circulatory system via the subclavian veins. Now, lymphatic vessels differ from our circulatory system because lymphatic vessels move only in one direction, and similar to our veins, lymphatic vessels have valves to keep that lymph moving in one direction. So only permit one-way movement of that lymph. And these capillaries, like we saw, are interwoven into the capillary beds of the vascular system, and this works really well because they're right there near the fluid that they're going to uptake. Another difference between lymphatic capillaries and our capillaries of our vascular system is that the lymphatic capillaries have cells that fit loosely together. So where the capillaries of the vascular system have very tight junctions, and they're only going to allow select items to move in and out like water and small particles and gases, the capillaries of the lymphatic system are going to allow bigger particles to move in and be carried away through the system. In the walls of the intestinal tract, these lymphatic capillaries have a special name called lacteals, and the job of these lacteals is to transport fats into the bloodstream. Now, one other thing that we need to recognize is that how similar to how we can get varicose veins. Similar things can happen in our lymphatic system if lymph is pooling in those vessels. Then we can get some of these little bulging areas that look like beads if we were to look at them with different types of imaging. So once this lymph fluid is picked up by the lymphatic capillaries, it's going to travel through the lymphatic system until it meets these terminal ducts of the lymphatic system, and those are the right lymphatic duct and the thoracic duct. The thoracic duct is the larger one and drains about 3/4 of the body's lymph, and then that lymph fluid is going to dump into the venous system. And on the left side, it's going to dump into the the junction where the left internal jugular and the left subclavian vein meets. And on the right side, it's going to dump into the junction where the right internal jugular and right subclavian vein meets. That is going to join into the superior vena cava and will become part of the circulatory system once again. Now, one extra little component of the thoracic duct located at the most inferior part of the thoracic duct is something called the cisterna chyli. And the cisterna chyli is responsible for, it's kind of like a holding pouch for lymph fluid. So it kind of serves as a holding area for lymph moving towards its point of entry into those veins. Essentially, the lymphatic system plays a big role in fluid hemostasis because the fluid that is not absorbed back into the circulatory system is absorbed into the lymphatic system, and this prevents the accumulation of too much fluid in the tissues. However, if things aren't working correctly, we could see how edema can occur if there's a situation where our lymphatic system isn't taking up that extra fluid like it should. So when the lymphatic system is not absorbing that fluid in the tissues like it should, we get swelling. That swelling is referred to as lymphedema. This could happen because there's some sort of blockage in the lymphatic vessels. It could also be due to some sort of congenital abnormality or maybe some sort of injury. Now, if sometimes in rare cases, little parasitic worms can block those passages of the vessels, and this can lead to extreme lymphedema, and that's this picture here on the bottom is representing that elephantiasis, that the extremity begins to resemble that of an elephant. If there is inflammation in the lymphatic vessels, that is called lymphangitis, and that causes these reddened areas that you can see on the image here. Typically, lymphangitis is due to some infectious agent, and if it is not taken care of in a timely manner and treated, it can lead to septicemia, which could ultimately lead to death. So lymph fluid is carried via the afferent vessels, which afferent meaning towards the node, into the lymph node. And the lymph node is this magnificent little filtering device, and it is made of reticular tissue. Now, if you remember back to our lecture on tissues, reticular tissue is a fibrous connective tissue. Remember, it's made of these thin webs of collagen fibers, and it makes this net-like filter. And so particles get trapped there in this web of reticular fibers that are suspended in the lymph nodes. In the core of the lymph node is something called the germinal center, and this is where immune cells are produced. And so this is really a great design because these immune cells are right there and ready to attack this debris that gets caught in this webbing of the lymph node. Okay, so that is a very good system. So they phagocytize and use other biological processes to break down this debris that gets trapped there. The fluid then gets carried away by the efferent vessels of the lymphatic system. We already talked about metastasis in prior lectures, and this is how cancer cells metastasize. And unfortunately, cancer cells can easily slip through this netting in the lymph nodes and travel through the system and be deposited in other parts of the body. Now, if we have swelling of the lymph nodes, maybe sometimes there's an infection or cancer, it can be a sign of cancer. We get lymphadenitis, and lymphadenitis is inflammation of those lymph nodes. Predominantly, we see them around the clavicle, in the neck, in the axilla, and in the groin are common areas that this occurs. And commonly, way back when, before we had sentinel node biopsies, we used to do axillary node dissections when we would do mastectomies. And the reason for this was hopefully to prevent metastasis from the breast and to other areas of the body. So we would remove all of those lymph nodes. We still do that if we do find a dirty sentinel node, we find cancer in that sentinel node, then we will go ahead and do that invasive dissection. However, if the sentinel nodes are clean, then we don't have to put the patient through that invasive procedure. So that's a really great thing that technology has helped us to be able to do. Lymphoma is typically a malignant tumor of the lymph nodes. So sometimes it can be benign, but that is really rare. There are two principal types, Hodgkin's disease and non-Hodgkin's lymphoma. And really the difference is where they develop. So Hodgkin's lymphoma develops in lymphocytes called Reed-Sternberg cells, and non-Hodgkin's develops in B lymphocytes, T lymphocytes, or natural killer cells. They basically have the same type of symptoms. So they're characterized by enlarged lymph nodes, anemia, weight loss, weakness, fever, and this can spread to other lymphoid tissues like the thymus and the spleen. Non-Hodgkin's lymphoma is sometimes characterized by skin rash as well as abdominal, chest, and bone and joint pain. They're not really sure why this occurs, but typically they present the same way. Here we see imaging of the lymphatics and the lymph nodes, and this is called a lymphangiogram. And the way that they do a lymphangiogram is they will inject dye, and the dye will infiltrate the lymphatic system and the lymph nodes, and they will light up on X-ray. Here we're looking at the lymphatic drainage of the breast, and you can see all of these little green lines, and the little are the lymphatic vessels, and the little round pea looking shaped structures are the lymph nodes. You can see here why an individual that had a mastectomy would have lymphedema because of the way these lymphatics run down the arm. Removing those axillary nodes, as we typically do for mastectomies, there is going to be a difficulty for drainage of lymph fluid in that side, and so we will see that that's characteristic in a mastectomy patient. If we're doing vitals on a mastectomy patient, we want to avoid taking a blood pressure in that affected arm. So now we're going to talk about some lymphoid organs, and the first one we're going to talk about is the thymus. So the thymus is located in the mediastinum, and let me just circle it for you. It is right here. It's fairly small. It's about an ounce worth of tissue, and it is really vital in producing lymphocytes called T lymphocytes or T cells. And it helps me to remember that they're produced in the thymus because thymus starts with T and it produces T cells. It also produces thymosin, and that is a hormone that helps these T cells develop and grow up and help fight for our immunity. It's most active when we're children, and then as we age, it starts to shrink and shrivel away, and it's mostly replaced by fat. And by the time we're about 60 years old, it's about half of its size, and by 80, it's pretty much non-existent. And if we later on, we'll talk about birth and growth and development and aging, and it makes sense that the immune system declines over age, over time, and one of those reasons has to do with this atrophy of the thymus. The tonsils are the next on our list to talk about in our discussion of lymphoid organs. There are three sets of tonsils that we have, and if you look at this image here, the very top ones are the pharyngeal tonsils. You might have heard them called the adenoids, and the ones below that are the palatine tonsils. And I remember where these are located because they're right at the back of the palate, so straight at the back. These are what we refer to as our tonsils or the tonsils, and then we have some lingual tonsils there that are right behind the tongue. We can live without these, and sometimes they do become chronically inflamed, the tonsils and the adenoids, and so we can remove those. Oftentimes in children, we do tonsillectomies and adenoidectomies as necessary. Here you can see some rather sickly tonsils. They have these white dots on them. Sometimes we refer to them as tonsil stones. They're kind of these hardened areas. And these guys are really great for latching onto bacteria and other debris that invade our mouth and nose and pharynx and filtering it out and attacking it. However, sometimes they can become hypersensitized, and then we get this chronic infection that you see here, and then these would definitely need to be removed. The spleen is the largest lymphoid organ in our body, and it is located in the left upper quadrant right under the ribs there. The ribs kind of helps protect it. However, it is a pretty common injury in motor vehicle accidents. You can live without your spleen, so if their motor vehicle patient or something like that comes in with a ruptured spleen, there's going to be a lot of bleeding because the spleen has a very large network of veins. It holds about 1/2 liter of blood. So I'm probably just going to take that out to stop the patient from hemorrhaging. That would be called a splenectomy. Aside from its abilities to filter out and phagocytize bacteria, it's also the red blood cell graveyard. This is where red blood cells go to die and be broken down and digested, and then the spleen does this magnificent thing. It harvests the iron so that the body can reuse it to manufacture hemoglobin. Now, sometimes the spleen will become significantly enlarged. This is called splenomegaly, and there are some different causes. Hemolytic anemia can be one. Remember, if we're making a lot of blood cells and a lot of blood cells are dying, they're going to go to the spleen. That's going to cause an enlargement. Scarlet fever, syphilis, and typhoid could also be other conditions that could cause splenomegaly. So our skin is our first line of defense. We've talked about that before in previous lectures, and now we're going to learn that our immune system is that next layer of defense for our body. It's really like all of these little armies in our bodies ready to go to battle to protect us against invaders. Now, the white blood cells do most of the heavy lifting of our immune system. We've talked about the lymphoid organs and the lymphatic system, and now we're going to talk a little bit more about the immune system, but they really work together in a collaborative way to keep us healthy and to protect us from microorganisms or harmful substances. And along with the white blood cells, there are also some chemicals that cells produce that help to develop our immune system as well and keep it up and running smoothly. And there are some different types of immunity that we're going to cover in our discussion as well. No doubt all of us have been sick before. We've either gotten a cold or the flu, or we've hurt our knee, or we've gotten a cut or something like that. And anytime one of these things happens to us or inside of us, that triggers an inflammatory response. And that inflammatory response, if it's caused by some sort of invading microorganism, is going to start a chain of events in our bodies. So we're going to look here at this little chart, this feedback loop, and at the point where some sort of invader enters our tissues, that's going to cause an inflammatory reaction. So different cells in our bodies are going to come to the rescue. They're going to start releasing different chemicals. Something that is called chemotaxis is going to happen. Chemotaxis is really just the movement of a cell or an organism. So the armies are going to take to the battlefield. Increased blood flow is going to occur. If you've ever had a cut or a bump or a bruise of some kind, you will notice that there is redness in that area. So increased blood flow is going to be part of that inflammatory reaction. Vessels are going to dilate so that they can increase that flow to that area that needs treatment. This is how those white blood cells are going to get there, right? They're rushing to the aid, and the freeway that they take is the circulatory system, right? So there's going to be increased vascular permeability, and what that means is that we want those white blood cells and those chemicals to be able to get out and into the tissues and do what they need to do. So they're going to become more permeable. There's going to be an increase of white blood cells at the site so that they can start fixing things, all right? Those white blood cells, like our eosinophils and our neutrophils and our macrophages, they're going to be phagocytizing those foreign invaders, whether it's a bacteria or a virus of some sort, until it is all cleared up and no more invader is present, and then the process will come to a halt. However, if bacteria still remains, it's going to continue to keep our immune system activated. That's when we might get some additional symptoms in there, like lymphadenitis, right? Inflammation of our lymph nodes around our neck and clavicle area, axilla, groin, and maybe also inside as well. There's lymph nodes in and around our intestinal tract and deep inside our tissues as well. So we might be able to see that on some sort of imaging. And if you remember back to a time when you were ill and you were probably infected and you didn't even know it. So there's some sort of incubation period, right, where we have it and the bacteria are multiplying, but we don't have symptoms yet. And that's called the incubation period. The period where it starts to ramp up and you start to feel the onset of those symptoms and they kind of get progressively worse and progressively worse, that's the prodromal stage, right? And then at some point there's going to be a peak. Hopefully symptoms at that point are going to start to decline and convalesce or go away altogether. So this is the inflammatory response that we're talking about. It happens because of the job that the immune system does to protect us. So now we're going to talk about two different types of immunity. The first type we're going to talk about is nonspecific or innate immunity, and the second type we're going to talk about is adaptive immunity. Now when we think about innate immunity, innate means to be born with. So these are things that we are automatically born with, and these things are not specific, which means we're not going to be developing antibodies through these mechanisms. Our body is not going to remember these types of defenses. It's just something that's automatic that we already have. It's very general and non-specific, and it consists of our first responders. Things like our phagocytes, so neutrophils, right? They're phagocytotic cells, the most numerous ones that we have in our body. Those macrophages, those gigantic overgrown neutrophils. Dendritic cells are also going to be part of that, as well as natural killer cells. Now, when there's some sort of crisis or invader in our body, these chemicals called cytokines are released. That is part of the inflammatory process. Those cytokines are going to trigger white blood cells to come to that area where there is danger. So the white blood cells are attracted to the cytokines and they respond. First response is our innate immune system, and some components of that system are our tears and our mucus secreted by our mucous membranes and our skin. So those are some common elements. Remember, innate is non-specific. It's things that we're already born with that are going to be the first responders to help us protect ourselves from invaders. The other type of immunity is called specific immunity. It is also referred to as adaptive immunity because of its ability to recognize and respond to a specific pathogen the next time around. All right, so it's very specific because antibodies are now going to be developed against that particular invader, and memory cells will store that information. And if the invader is around the next time, those memory cells will go to action and stop it, but it won't stop something else that it hasn't been exposed to. So the first time that you're sick with something, You will have symptoms and you'll experience the sickness, but due to our specific immunity, the second time you will not. You probably won't even know that you're exposed to it. So it's very specific. It takes a little bit longer of a response time, and there is some developmental processes that have to happen so that the next time we're exposed, it can protect us quickly and adequately against that specific invader. There are two types of adaptive immunity that we're going to talk about, and those are natural and artificial. Adaptive or specific immunity, which is also sometimes called acquired immunity, which makes it kind of even more confusing, is a type of immunity where our body develops immunity in one of two ways. The first is actively, and the second is passively. So when we think of active immunity, let's think of our body having to actually go to work to do something to develop that immunity. Passive immunity means the body doesn't have to do anything. It just sits there and the immunity is given to it freely. So in terms of natural immunity, passive natural immunity, a good example is when the baby receives antibodies through the mom's milk or through the placenta. Example of this is immunoglobulins that help to strengthen our immune system. So that would be a type of natural passive immunity where the body isn't having to do anything, it's just getting a gift from the mom. Now, active natural immunity happens anytime that we're exposed to something and it's not deliberate. So we're exposed to some sort of bug. Maybe it's a cold. COVID is a good example, measles, chickenpox, anything that wasn't deliberate. We were just out in the world doing what we do and we got exposed to it. That is an example of active natural immunity. Just as there is active and passive natural immunity, there is also active and passive artificial immunity. So when we're talking about artificial immunity, we mean that we are exposed to a causative agent on purpose. It was a deliberate exposure. Remember, natural means we were accidentally exposed to it. We didn't go seek to be exposed to chickenpox or seek to be exposed to measles, right? It was an accident. But here, when we're talking about artificial immunity, we mean that we exposed ourselves to it on purpose. Active artificial immunity is when we get some sort of vaccination or immunization that causes our immune system to go to work to make antibodies and react to it so that later those memory cells will remember that foreign invader and protect us from it. Passive artificial immunity means that whatever we're being exposed to or whatever we're being given was taken from somebody else's body. It did the work. It was made in the lab. Whatever the case may be, that immunity is injected into us. A good example is if you're exposed to hepatitis A. If you're exposed to hepatitis A, something that they give for that is gamma globulin, and that would be an example of passive artificial immunity. They're taking those antibodies that have already been developed and they're putting them into our bodies, and our body doesn't have to do anything at all. It is a passive process, no energy being used whatsoever. So remember, artificial immunity means that we are exposing ourselves to it on purpose. Actively means our body has to go to work to develop those antibodies. Passively means We're just getting those antibodies and our body doesn't have to do anything at all. It's just getting a gift. So there are several immune system molecules that we're going to talk about. And the first one is cytokines. And cytokines, it's important to remember that cytokines are really team players. They are the ones that are going to be the molecules that participate in both innate and adaptive immune processes, and they are really the go-betweens between these molecules. So they communicate. They are the communication majors. They communicate with all these other white blood cells that make up our immune system, and they trigger those immune responses. So the cytokines are a really important part of the immune process. Remember that antibodies are part of our adaptive immunity, and antibodies are triggered by foreign invaders. So antibodies are protein compounds, and they have these concave combining sites that can specifically fit with a specific type of antigen. So if you see in this bottom picture here, the red object represents the antigen, and you can see on the surface of it there's a pyramid and a sphere and a rectangle like shape, and this is on the surface of the antigen. The antibodies have those complementary pairings, so they fit together like a lock and key. And when an antibody combines with the antigen, that forms a antigen-antibody complex. This is referred to as humoral immunity or antibody-mediated immunity. Now, this joining of the antibody and the antigen neutralizes whatever is going on with the invader. So if the invader produces a poisonous toxin or poison, this is going to make it non-poisonous or harmless. It can also initiate agglutination, which means it's going to cause those enemy cells to clump together, and that's going to be easier for macrophages to phagocytize or engulf and ingest those invading particles. Really awesome. Now, sometimes when this antigen-antibody complex is formed, the antibody is changed slightly. And when the antibody is changed slightly, that allows for other proteins to attach to it. Now, these proteins are enzymes, and these enzymes are called complement proteins. And these complement proteins are inactive, floating around in our blood, just waiting for the opportunity to blow something up. And I have two images here, and the reason I have the image on the right is because it shows that some of those enzymes in that complement cascade are called C4 enzymes. And we don't really need to know what these enzymes are called, but I think it helps us to remember that these complement enzymes that we're going to refer to as C4 actually cause the invading cell to explode. And the way that it does that is by making these little rings, little donut holes in the membrane of the invading cell. And when that happens, sodium rushes into the cell. We already know that water follows salt, and so water is going to rush into the cell as well, and the cell is going to expand and expand and expand until it explodes. So there you go, C4 enzymes used to explode invading cells. It doesn't get any more awesome than that. Now, two important phagocytic white blood cells are the neutrophils and the monocytes. The neutrophils are the most abundant type of phagocyte, and the monocytes, once they get into the tissues, will typically develop into these overgrown phagocytic cells called macrophages. And then the third type of cell that is also involved in phagocytosis are called dendritic cells. And if you remember from the neuro chapter, the nervous system, we talked about dendrites, and dendrites are these mini little branches. And so these dendritic cells are highly branched cells, and all of these cells are produced in the bone marrow. And once the dendritic cells leave the bone marrow, they colonize in areas like the skin and the lining of the respiratory system and the digestive system. So anywhere where there's mucous membranes, the dendritic cells are going to colonize there, and they're going to help protect us from threatening particles and cells that could try to invade those areas. Now, antibodies also play a role in this, and antibodies can also be used to flag invaders for the phagocytic cells. So antibodies can attach to the surface of the invader, and then the macrophages and the neutrophils and the dendritic cells will then be able to identify them and engulf them and neutralize them and destroy them through that phagocytic process. There are three types of lymphocytes that we're going to talk about in this discussion, and they are the B lymphocytes, the T lymphocytes, and the natural killer cells. And the natural killer cells are predominantly the ones that will attack tumor cells. And you can see in this bottom one here, I just put a little image just to remind us that the natural killer cells are typically the ones that attack tumor cells. Because B cells were found in bursa, which is an organ of birds, they're referred to as B cells. So that's how they got their name. And they develop in the liver and the bone marrow of children, but predominantly only in the bone marrow of adults. So let's talk about what that developmental process looks like. So they are produced in the liver and the bone marrow, and they stay there until they mature. Now, once these B cells are mature, they're still inactive. They're not performing any immune responses yet. They leave the site where they're formed and they enter the bloodstream and they travel to the lymph nodes and they set up shop there. Now, they're still inactive. They're not doing anything yet. They don't become active until they come into contact with an antigen or a key, right, that fits their specific lock. Ooh la la, it's like a match made in heaven. So now these B cells become activated, right? And how do they know that this antigen is out and about? Well, the cytokines, remember, they're the communicators. So they're whispering in the ears of the B cell and they're like, hey, you know, the key for your lock, it's over there. Okay, so once they come into contact with this antigen, that's when they become active. Now, two different types of B cells are going to develop at this point. Plasma cells, which are called effector cells. And it's easy to remember the two because effector cells cause an effect, right? They're doing something. So these plasma cells are going to be pumping out this specific antibody like it's going out of style. Thousands of molecules per second for the few days that it is alive. So that's one type of cell, the plasma cell, aka effector cell. Those are going to be antibody factories, okay? And then the other type is the memory cell. Now, B memory cells are like an elephant, they never forget an antigen. Okay, so what they're going to do is they're going to nestle down and they are going to lay in wait, and they have this memory of this specific antigen. So they're not going to do anything, they're not going to be active unless that same antigen comes carousing around the next time. And then the same process will take place. More plasma cells will be developed. The plasma cells will go to work pumping out the antibody, their antibody factories, and the memory cells will go back and lay in wait in case that invader comes around again. So this is the developmental process of B cells. Again, the B cells are a part of humoral immunity, which helps us to produce resistance against specific antigens related to specific diseases. Unlike B cells, T cells develop in the thymus gland. And the way I remember this is T cell and thymus starts with T. So T cells develop in the thymus, and once they leave the thymus, they enter the bloodstream and they head for the lymph nodes, and they're going to set up shop in those lymph nodes, and they're just going to hide out and wait. And eventually, cytokines are going to spill the beans that the T cell specific antigen is in town, and then the T cell is going to get activated. When the T cell is activated, a similar thing happens as does with the B cells. They are going to start to produce clones of themselves, and those clones are the effector cells, and those effector cells are going to react with the antigens. They're also going to produce some of those memory cells, and those memory cells are going to lay in wait until they are exposed to that same antigen again, if and when. Now, there are three types of T cells. The first one is cytotoxic T cells, and just like the word sounds, they release a toxin or a lethal poison that will kill the foreign invader. Helper T cells are those cytokines. They release those cytokines that chemically communicate to T cells and to B cells to tell them to activate and attack. And then lastly, the regulatory cells are really important because they're the ones that shut down the immune response, so you don't get this overactive immune response or an inappropriate immune response. Now, I mentioned that the B cells produce humoral immunity. And when you hear humoral immunity, I want you to think about antibody type immunity. All right, so humoral immunity relies on the B cells' production of antibodies. Remember, they're the antibody factories. They pump it out, pump it out, pump it out, thousands of molecules per second. The T cells are a little bit different. T cells produce something called cell-mediated immunity. This means it does not act or work by producing antibodies. It attacks the invader directly, and while B cells focus on extracellular invaders, a good example would be a parasite or a bacteria. T cells focus on intracellular invaders, and a good example of an intracellular invader is a virus. Remember, viruses enter the host cell, take over its machinery, and use it to do its dirty work. Okay, so T cells are going to attack the invaders directly by binding with them, and another thing that T cells do is they provide immunity against cancer cells. Okay, so there's the difference between B cell development and T cell development. I hope this is helpful. A hypersensitivity of the immune system is an inappropriate or excessive immune response. And we're going to talk about three different types: allergy, autoimmunity, and alloimmunity. Now, we're all probably familiar with allergies. We all probably have some sort of allergy. Allergies occur when a person becomes sensitized to some sort of trigger or some sort of allergen. And usually this happens over repeated exposure to the allergen. And a good example for healthcare workers is latex allergy. And most times, healthcare workers do not have an allergy to latex, but overexposure and repeated exposure to the latex of the gloves can cause an individual to become sensitized, and then there is this delayed allergic response, and in the case of latex allergy can result in contact dermatitis. Now there are other, if you have allergies to ragweed or pollen or something like that, you're going to get the itchy eyes, the runny nose, those kinds of things. So it can manifest itself in a variety of ways. Here is just a little sneak peek at what contact dermatitis may present like. These little red rashes on the forearms here. Autoimmunity is the inappropriate excessive response to self-antigens. So this is basically the immune system attacking itself. Some examples of that would be lupus. Another example, rheumatoid arthritis is another example. And basically it's an over activity of the immune system, and it inappropriately attacks these self-antigens that are floating around in our system. And here is a quick peek at what lupus could present like. It gets the erythematosus from the reddening rash that it can cause on the skin, but it can also attack the joints and other systems as well. Alloimmunity is the excessive reaction to antigens from another human, and two examples of this could be something that we talked about in a previous lecture, the erythroblastosis fetalis, where we have a mom that is a negative, Rh negative, and we have a baby that's Rh positive. That could cause the mom's body to attack the baby's red blood cells. And then the other example of alloimmunity is when an individual receives a transplant. So we do tissue mapping and typing to find tissues that are closely related. So hopefully there won't be as many antigens that are seen as foreign invaders on the surface of the cells. So this is another example of how the body could reject or attack that tissue. Interestingly, corneal transplants are the most common transplants in the United States, and tissue rejection of corneal transplants has been documented up to 20 years post-transplant. So it can really happen at any time. We're coming into the home stretch here. We're going to talk about a couple of immune system deficiencies. And the first one is congenital immune deficiency or immunodeficiency, which is really rare, but it is something that the individual is born with. One example is a severe combined immune deficiency, or SID, which is caused by the disruption of stem cell development. So this is going to affect both humoral immunity and cell-mediated immunity. And some ways that we treat this is temporarily we can give them some immunoglobulins, inject them with that. And then long-term, we're looking at bone marrow transplants from healthy donor cells. Acquired immune deficiency, like the name implies, is something someone acquires or develops after birth. And an example that I'm sure you've all heard of is acquired immunodeficiency syndrome, or AIDS, which is caused by a viral infection of the T cells. So the virus actually invades, it goes into the T cells, it hijacks the machinery in there and uses it to make clones of itself, and that's how it spreads. Now, currently there isn't a cure for HIV, but there are things that they are doing to prolong the life of the individual, and one of those things is to create these cocktails of antibiotics. Viral infections are really difficult to treat, one, because it's difficult for us to make medications that can just target one of our cells that has the virus in it, so that's difficult. And the other thing that makes it difficult is that viral infections, they mutate rather quickly. So on that front, it's kind of a double whammy for us to figure out how we can cure viral infections, and we're getting the real-time knowledge of that now as we are desperately searching to find a cure and or a treatment for the COVID virus. I know this chapter is pretty meaty to sink your teeth into. I hope that it was helpful. And again, thank you for listening.